Have you ever walked into a doctor's office and felt dismissed, rushed, or treated as if your age defined your worth? Have you noticed your symptoms brushed aside as just aging, or been given explanations so simplified they felt patronizing? If you're over 60, what I'm about to share will strike you deeply. After looking closely at the healthcare system and speaking with doctors, nurses, and advocates, I uncovered 7 shocking truths about how medical professionals really see seniors. These truths may be costing you respect, dignity, and even years of your life. This isn't just a wake-up call. It's a call to action, to reclaim your voice and your health. Stay with me until the end, because I'll not only expose these hidden biases, but also share proven ways to demand the care you deserve, turning you from a passive patient into a strong advocate for your own well-being. Now, let's begin with the first warning. They often label you as high maintenance before you even say a word. From the moment your chart marks you as 65 or older, a subtle but powerful bias often takes hold. Many doctors unconsciously categorize seniors as difficult or high-maintenance patients. This isn't usually personal. It's a systemic issue in healthcare. Efficiency and cost-cutting push providers to see older adults as time-consuming, resource-heavy, and complex. Dr. Ellen Carter, a former emergency room physician turned advocate for senior healthcare reform, explains it clearly. Medical training rewards speed, moving as many patients through as possible. Seniors, with detailed health histories and longer appointments, are seen as slowing down the process. That high-maintenance label gets applied before you even speak. And the result? Rushed visits, skipped examinations, or avoided tests that could make all the difference. Take Margaret, a 72-year-old retired teacher. She carefully tracked her fatigue and shortness of breath in a detailed journal. Her doctor barely glanced at it, dismissing her with, "At your age, that's just life." But Margaret didn't give up. She sought a second opinion, and this time a cardiologist diagnosed her with heart failure, something that could have been caught much earlier if her first concerns had been taken seriously. Had Margaret not spoken up for herself, her condition might have silently worsened, leading to hospitalization or even something more serious. So how do you fight back? The key is to enter every appointment prepared and confident. Start by clearly stating your goals. For example, you might say, "Over the past 2 months, my energy has dropped by about 30%, and I struggle to walk short distances without feeling winded. I want to understand the underlying cause." This signals that you're focused, engaged, and expecting clear answers. Bring a simple 1-page health summary with your medical history, medications, and a brief timeline of your symptoms. This helps busy doctors see the big picture quickly and shows that you are proactive about your health. If your concerns are brushed aside, request a follow-up visit dedicated to the issue. You could ask, "Can we schedule a longer appointment to discuss my heart concerns thoroughly?" Take notes during the visit, or, where legally allowed, record the conversation to ensure you don't miss important details. Bringing a trusted family member or friend can also strengthen your voice and make sure your questions are taken seriously. The second warning is even more sobering. Your care is often dictated by money, not medicine. Behind the walls of your doctor's office, financial pressure looms large. Insurance companies and hospital administrators push providers to cut costs, especially for older patients with more complex needs. With shrinking reimbursements and crowded schedules, doctors may choose cost-saving shortcuts instead of comprehensive care. In fact, a 2023 study in the Journal of General Internal Medicine found that physicians spend 25% less time listening to seniors compared to younger patients. Too often, doctors assume that fully addressing seniors' health concerns is simply too costly or time-intensive. This kind of economic thinking can lead to treatment plans that fall short. Take Robert, a 68-year-old retired mechanic who struggled with chronic knee pain. His doctor dismissed surgery, prescribing long-term painkillers instead, claiming a knee replacement was too risky at your age. Robert wasn't convinced. After doing his own research, he met with a geriatric orthopedist who determined he was an excellent candidate for surgery. The procedure restored his mobility and allowed him to return to his active life. Only later did Robert discover that his first doctor's advice was shaped more by hospital policy and cost concerns than by his actual health needs. So, how can you fight back? Always ask direct questions. For example, is this recommendation based only on my health, or are cost factors influencing the decision? Show that you've done your homework by citing credible sources like the National Institutes of Health. You might say, studies show knee replacements succeed in nearly 90% of patients my age. Can you explain why it isn't being considered for me? If something feels off, don't hesitate to seek a second opinion, especially from a geriatric specialist. They are trained to focus on the unique needs of older adults and less likely to let financial pressures override medical judgment. And remember, know your insurance coverage. If treatment is denied, ask for documentation proving its necessity and file an appeal. Don't ever let budgets decide the outcome of your health. One of the most harmful barriers seniors face is when symptoms are brushed off as just aging. This form of medical gaslighting is far too common and can delay critical diagnoses. A 2024 report from the American Geriatric Society found that nearly 80% of serious conditions in adults over 65 are first misattributed to normal age-related decline instead of being properly investigated. Chest pain, shortness of breath, memory lapses, these are often dismissed as simple fatigue or wear and tear, leaving dangerous but treatable conditions undetected. Take Susan, a 70-year-old retired librarian. She went to her doctor with persistent dizziness, only to be told it was a normal part of growing older. Unconvinced, she pushed for tests, which revealed a treatable inner ear disorder. With the right care, her dizziness disappeared. Imagine if Susan had accepted that first answer. She could have continued to suffer, risking falls and further complications, all because her symptoms were minimized. This pattern of dismissal isn't just frustrating, it's dangerous. Fatigue can signal heart disease, thyroid problems, or anemia. Joint pain may point to treatable arthritis or autoimmune conditions. Cognitive changes can stem from reversible causes like medication side effects or vitamin deficiencies. Yet seniors are too often told to accept these symptoms as inevitable, delaying care that could improve quality of life. How to push back against medical gaslighting. Challenge vague explanations. If a doctor says, "This is normal for your age," ask, "Can you show evidence that this symptom is typical for my age group?" Prepare a clear symptom timeline to convey urgency. "I noticed dizziness in June. It has worsened over 3 months. This isn't gradual." Demand the same rigor a younger patient would receive. "If I were 40, what tests would you order? Can we follow that protocol?" Bring a trusted advocate to reinforce questions and ensure nothing is overlooked. If symptoms persist or you're still dismissed, seek a second opinion from a geriatrician or a relevant specialist, for example, a cardiologist for heart-related concerns. Persistence and preparation are essential. By arming yourself with knowledge, confidence, and a proactive mindset, you can navigate systemic bias and secure the care you deserve. Don't let ageism or financial pressures dictate the quality of your care. Your health is worth defending. One troubling reality in senior healthcare is that many medications are prescribed not to heal, but to control. Sedatives, mood stabilizers, antipsychotics, and antidepressants are often given to older adults to make them more compliant or easier to manage in nursing homes, hospitals, or rehab centers. This practice, known as chemical restraint, prioritizes efficiency over true patient well-being. Dr. James Patel, a geriatrician and former nursing home director with more than 25 years of experience, explained that countless seniors are prescribed psychiatric drugs without a clear medical need, simply to ease the load on overworked staff. It's a systemic issue tied to understaffing and the lack of personalized care. The numbers are staggering. A 2023 report from the National Center for Health Statistics found that over 40% of seniors in long-term care facilities receive psychiatric medications, while only 15% actually have a documented mental health condition. The consequences are serious: confusion, dizziness, higher fall risk, and even faster cognitive decline. Antipsychotics like risperidone or haloperidol, often prescribed off-label for agitation, carry black box warnings for increased mortality in older adults with dementia. Consider Clara, 66, recovering from hip surgery in a rehab center. After she questioned the slow pace of therapy, her team prescribed an anti-anxiety drug to help her adjust. Within days, she developed disorientation and memory lapses, side effects never explained to her. One evening, confusion led to a fall and a fractured wrist, setting her recovery back for months. Clara's story reflects a wider, silent problem: medicating seniors to suppress behavior rather than address root causes, often without informed consent or proper monitoring. How to fight back? Know your rights and insist on informed consent. Before starting any new medication, ask, what specific condition is this treating? What benefits should I expect, and how will we measure them? What side effects are likely, and how might this interact with my current drugs? Request evidence, clinical guidelines, or senior-specific studies to justify the prescription. Use reliable resources such as PubMed, NIH Medline Plus, or the American Geriatric Society's Beers criteria to evaluate appropriateness for older adults. Schedule a comprehensive medication review with a clinical pharmacist or geriatrician at least every 6 months, or immediately if you notice changes in mood, thinking, or physical function. Before starting any new drug, establish a clear baseline with objective measures, cognitive tests, such as the mini mental state examination, and physical assessments, balance or mobility tests, so side effects can be tracked accurately. Document any adverse reactions and report them to your provider promptly. Whenever possible, involve a trusted family member, friend, or professional patient advocate to ensure your concerns are heard and to deter dismissive responses. If you suspect a medication is being used to control rather than treat, seek a second opinion from a geriatric specialist who prioritizes patient-centered care. Know your rights under federal regulations like the Nursing Home Reform Act, which requires that medications in care facilities be medically necessary and not used as chemical restraints. 5. They assume your mind is slipping. A pervasive and harmful stereotype in healthcare is that seniors' cognition inevitably declines, leading to oversimplified explanations, limited treatment options, and exclusion from innovative therapies. This ageist bias causes providers to underestimate older adults' mental capacity and default to one-size-fits-all care instead of personalized, evidence-based treatment. Neuropsychologist Dr. Laura Simmons explains, "Too often providers assume older adults can't grasp complex information or tolerate advanced treatments. The result is a cascade of suboptimal care. Seniors are shut out of clinical trials, cutting-edge therapies, and even detailed conversations about their options. Research backs this up. A 2022 study in the Journal of the American Geriatric Society found that seniors are significantly less likely to be offered trial participation than younger patients, even when they meet eligibility criteria. Edward, a 73-year-old retired chemist and lifelong learner, felt this bias firsthand. After being diagnosed with early-stage prostate cancer, he expected a thorough review of options. Instead, his oncologist recommended a simple course of hormone therapy and dismissed newer approaches, immunotherapy or precision radiation, as too complicated for someone his age. Unsatisfied, Edward did his homework. He discovered strong evidence that these advanced treatments could work well for seniors with profiles like his. A second opinion at a center specializing in personalized care opened the door to a targeted therapy that controlled his cancer while preserving his quality of life. Edward's story shows how assumptions about cognitive decline can quietly strip seniors of the best available care. The bias also shows up in everyday communication. Being talked to in oversimplified terms, having questions brushed aside, and feeling discouraged from taking an active role. Shouldn't every patient, at any age, get clear information and full access to evidence-based choices. Over time, this bias erodes confidence and worsens outcomes. Patients delay care or hesitate to challenge inadequate plans. How to fight back? Take control of each visit by demonstrating your mental acuity and engagement. Open with, "I've researched my condition and have specific questions about my options." This signals you expect to be treated as a capable, informed patient. Prepare science-based questions such as, "What's the mechanism of this treatment, its success rates in seniors, and why is it best for my case?" Leverage technology. Bring data from health apps, wearables, heart rate, activity, or your digital records to show active monitoring. Request a written treatment plan, including risks, benefits, and alternatives, so you can review it at home or with a trusted advisor. If you feel underestimated, say so directly. "I don't think my questions are fully answered. Can we go into more detail?" Bring a family member, friend, or professional advocate to reinforce your voice. If oversimplification continues, seek a second opinion from a geriatrician or other specialist who values engagement. Explore clinical research opportunities via clinicaltrials.gov and ask, "Am I eligible for any ongoing trials?" Clear, confident self-advocacy opens doors to better care and more respectful interactions. 6. They undervalue your life's worth. Perhaps the most disheartening truth is the systemic devaluation of older adults through metrics like QLIs, quality-adjusted life years, and DALYs, disability-adjusted life years. These formulas, used by insurers and health systems to allocate resources, often assign a lower value to a senior's remaining years than to a younger person's. The result? Older adults are denied potentially life-saving interventions, surgeries, transplants, advanced therapies, based on age rather than overall health or recovery potential. Medical ethicist Dr. Patricia Hayes at Johns Hopkins calls this ageism disguised as economics, a mindset that treats seniors as less deserving of costly care. A 2024 study in Health Affairs found adults over 65 are 3 times more likely to be denied elective surgeries or transplants than patients under 50, even after accounting for comorbidities. Should a formula decide whose life is worth saving? Helen, 69, a retired nurse with liver disease, met this bias head-on. Her first hepatologist recommended palliative care, citing age and limited benefit. Stunned, yet otherwise healthy and active, she sought a second opinion at a transplant center. After a thorough evaluation, she was approved. The surgery succeeded, and Helen enjoyed 12 vibrant years, defying the assumptions that nearly cost her the chance. Stories like Helen's are far too common. Seniors are denied care based on arbitrary age cutoffs, not medical fitness or recovery potential. The same bias shows up in quieter ways, being steered toward watchful waiting or conservative care instead of interventions that could improve quality of life. The system too often prioritizes cost savings over outcomes, leaving older adults to fight for equal care. How to fight back? Challenge age-based denials directly and demand transparency. Ask, "Would you recommend this plan if I were 45? If not, why does my age change the recommendation? And what evidence supports that?" Research outcomes for your condition in seniors using peer-reviewed journals, government databases, CDC, NIH, or advocacy reports, and bring that data to your provider to counter assumptions about your worth. For example, if you're seeking a transplant, cite studies showing successful results in older adults, such as a 2023 American Journal of Transplantation Analysis reporting comparable survival rates for liver transplant recipients over 65. Connect with senior advocacy groups, AARP, the National Council on Aging, or the Center for Medicare Advocacy, for guidance and potential legal support against age-based discrimination. Document any instance where care seems limited due to age. Such actions may violate federal laws like the Age Discrimination Act of 1975 or Section 1557 of the Affordable Care Act. If a treatment is denied, Pursue multiple second opinions from specialists at academic centers. Persistence and informed advocacy can be the difference between life-changing care and being dismissed by outdated metrics. 7. They undermine your trust in subtle ways. Providers may erode confidence with patronizing behaviors, slow, exaggerated speech, oversimplified explanations, or lines like, "Let's keep it simple," "Don't worry about the details," or "This might be too complicated." These cues imply you can't engage with complex information. Over time, that condescension breeds self-doubt, discourages questions, delays care, and normalizes suboptimal plans. The psychological toll is real. It chips away at autonomy and ultimately worsens health outcomes. A 2022 study in The Gerontologist found that seniors who felt patronized by providers were 30% more likely to delay follow-up care, leading to preventable complications. George, 71, a retired high school teacher with diabetes, lived this reality. When his primary care physician spoke in a slow, childlike tone about his management plan, he felt embarrassed and dismissed. He stopped asking questions. Months later, poor control led to a severe foot infection, an ER visit, and a long hospital stay. His story shows how condescension can silence patients and worsen outcomes. This undermining also appears when clinicians ignore a senior's expertise or life experience. Even those with scientific or medical backgrounds see their knowledge waved aside, eroding confidence. Over time, that erosion creates a cycle: disempowerment, disengagement, poorer health. How many complications could be avoided if respect and clear communication came first? How to fight back? Reclaim your voice. Address condescension directly and professionally. If you notice patronizing behavior, say, "I'd appreciate a detailed explanation of my condition and treatment options. I'm fully capable of understanding." Prepare for visits by researching your condition, Mayo Clinic, WebMD, peer-reviewed journals, and bring specific, evidence-based questions. For example, what are the latest guidelines for treating this in seniors, and how do they apply to me? Are there alternatives I should consider? This sets clear expectations for respectful communication. If you feel dismissed, call it out. "I'm concerned my questions aren't being fully addressed. Can we revisit them in detail?" Bring a trusted advocate, family, friend, or professional patient advocate to amplify your voice. Keep written records of each appointment, including any patronizing interactions, to review with your provider or an advocate. If the behavior continues, switch to a clinician who respects your intelligence and autonomy, ideally a geriatrician trained in patient-centered care. Use platforms like HealthGrades or ZocDoc to find well-reviewed providers. Join senior support groups or online communities to share experiences and strategies. The mutual reinforcement strengthens confidence and advocacy skills. You've just uncovered 7 hard truths about medical ageism: being labeled high maintenance, having your worth reduced to cold calculations, and facing biases that threaten your health and dignity. More importantly, you now hold practical strategies to fight back, demand respect, challenge dismissals with evidence, and secure the comprehensive care you deserve. Think of Helen, who fought for a transplant and gained a decade of vibrant life, or Edward, who refused watered-down cancer treatment and found targeted therapy that preserved his quality of life. Their wins began with knowledge and action. Now it's your turn to step into every appointment prepared, confident, and unafraid to insist on the standard of care that matches your needs. Wishing you health, happiness, and peace. And remember to subscribe to Healthy Aging Blueprint.